Thank you very much. Good morning. As Glenn said, Anne James sends her apologies. I know she was looking forward very much to coming to the conference today to talk to you about GS1 and the benefits it will have for our hospital and for our patients, and most importantly for our patients, but also for our staff as well. As Glenn said, unfortunately, due to a family commitment, she can't be here, but I will try and pull out some of the key messages I know she wanted to get across. It was quite funny. This time yesterday, I was really looking forward to coming to the conference and listening to my boss talk wisely about a subject that she clearly knows an awful lot about, and an hour later I was on the road with her presentation coming to this conference. But hopefully I can do it justice. So I think, and it's already been mentioned by speakers already, and I'm sure it will be over the next day and tomorrow as well. Like most NHS providers, we've had several years now of very tough financial environment to be operating in, and also very tough operational pressures on us as an NHS provider. And we've done what probably most NHS providers have done over the years. We've had programs of cost improvement programs again and again and again. We've had the big accountancy firms in to be our critical friend and to work with us to look at ways we could be more efficient, the way we can cut costs, how we benchmark against others. And I think as an organisation and as a trust board, we realise that we're probably coming to the end of some of that journey. There is things in the system we can do. We can always save money. There's always more we can do. But really, to meet the challenges that lie ahead, and many of us are experiencing today, we do need to focus our management effort on whole system approaches to transformation. And in Plymouth, we're part of the Devon success regime, so very much focused on whole system transformation. But the other very important part is being focused on innovation and transformation. And our board clearly sees GS1 as a key cornerstone in that commitment to innovation. So a little bit about us as a trust. So for those of you who aren't quite sure where Plymouth is, and I must admit when I applied for a job there 20 years ago, I was a bit surprised when I couldn't commute there from Basingstoke. So it's quite on the tip of the southwest. The area circled in blue is our catchment population as a district general hospital. So it's focused on the city of Plymouth, but also extends into East Cornwall and to the west of Devon as well. And that is, so we have a very urban population that we serve, and then we have quite rural, remote areas that we also look after as well. And those referral patterns probably haven't changed in the last 40 years. The red circle shows our tertiary catchment area. So as well as a district general hospital for Plymouth, we're also a specialist hospital for Devon and Cornwall. We are the major trauma centre for Devon and Cornwall, and we have all of the specialist surgical specialties to back that up. So we have vascular services, neurosurgery, cardiac surgery, thoracic surgery, interventional radiology, stereotactic radiotherapy, and on the list goes. So Plymouth is very much the specialist hospital for Devon and Cornwall. We're also a military hospital. We integrated the military hospital into Derriford over 17 years ago. And when you come to Derriford, if you come to Derriford, you'll see a lot of military uniforms around the place, and the military are very much part of who we are. We're also very proud of our teaching status. We became a teaching hospital several years ago now, and we have very strong links with both Exeter University and Plymouth University. And I think the last feature about the geography, we're predominantly a single site hospital. We do have a few satellites, but it is predominantly single site, and I'll probably come back to that a little bit when we talk about GS1 specifically. Some key facts, and this sort of is trying to introduce where we're coming from with GS1. So a lot of this is about demonstrating we are a complex organisation, like all hospitals really. So we have a lot of staff, we have 6,500 employees, we have a lot of patients, we have about 100,000 inpatients a year, just short of 90,000 ED attendances, several hundred thousand attendances in outpatients, and we have a lot of clinical activities going on. So just short of 5,000 babies are born in Derriford every year. We have just short of 40,000 operations are undertaken, and we take in excess of 350,000 images. So there's an awful lot of staff, an awful lot of patients, and an awful lot of clinical activity. The second part of these facts sort of shows the complexity of our supply chain. 2,200 suppliers, 175,000 unique items purchased for us every year, and they're delivered to in excess of 115 discrete locations across the organisation. So I think when you combine those two sets of statistics together, the scale of complexity of the organisation and the complex supply chain that's needed to support it, getting the right product to the right people at the right time in the right place is a huge challenge and a huge effort. And that really lies at the essence of our commitment to GS1 and how we see that if we can get that right first time, every time, then we can start to release the clinical time, and we can actually allow our clinical staff to focus on what we want them to do, which is making time to care for their patients. I'm going to come back a little bit to the challenges of and the context in which we're working. So this slide just tries to sort of mind dump all of the things going on in our world at the moment. So we need to improve our quality, we need to improve our efficiency, we need to become more responsive and improve our access times. We have a clear commitment to reducing harm. And we also have a commitment to reduce our costs that we spend in the acute sector. So in Devon, we know that we have a challenge over the coming years of just over 400 million to save. That translates to our hospital to a challenge of 100 million. And that is huge. And we know doing what we've always done is not going to give us that it's not going to be the answer to those sort of challenges. So again, back to our Trust Board's commitment to innovation. We know that innovation has to be at the heart of our change programme. Investment in infrastructure innovation is something we don't talk about a great deal, yet it is absolutely essential, and the benefits aren't necessarily immediate, but if we don't make those investments, then we can't reap the benefits in the medium term. And of course, having an efficient supply chain is a very important part of that agenda. So we are one of the 6 demonstrator sites. It's very early days for us as a demonstrator, but we do have some quite good foundations. So there's names of various systems that we already have in place and have been well established for a number of years, which I think give us a good starting point to take us on the next part of this journey. So we had Genesis in place, we had GHX, Nexus in place. We also have a comprehensive property management solution in place as well. So they were good foundation or good building blocks for what lies ahead. We also have quite an interesting in-house development. We call it Salus. It's a real-time inpatient management system that we've written ourselves. If you go onto any of our wards in the hospital, you'll see massive TV screens. Every single patient in real time is managed through those screens. We know exactly when they came in, when they're going home, who's looking after them, what's being done to them, what they're waiting for, and we're able to monitor that in real time. So some of those building blocks start to form part of that picture of what we're aiming with the whole. We also have a couple of key investments this year. So we're in the middle of implementing a new theatre system, which will be, GS1 will be an absolute key part of the standards that we need to build into that solution in order to get the full benefits that we want from it. And we're also out to the marketplace at the moment for an electronic prescribing solution. And again, there probably isn't a more important area than those two, prescribing and theatres, where we want to ensure that the application of these standards maximise the benefits to our patients. So finally, just summing up, and again, I think some of these things have come up from speakers already this morning. Why are we committed to GS1 standards as an organisation? Well, obviously, patient safety is absolutely at the top of that list. Whether we're talking about product recall, whether we're talking about electronic prescribing, whether we're talking about the ability to put in place safe controls and processes within theatres. Improving the patient experience, if we can get the right things to the right people at the right time, every time, then obviously that's going to have a significant benefit for the patients that we look after. Reducing operational costs is quite interesting. This isn't quite the same order of the list that Pat was talking about, but costs are in there clearly. Our commitment to saving money is really important as part of this agenda as well. And of course, what we've committed to do as a demonstrator is to share the learning as a demonstrator across the whole of the NHS. But finally, I guess, it is that message, right care, right time, right place. If we can get this right, we can release that time so clinical staff have more time to care. Thank you.